see. Okay.
I'm so nervous.
No, you're fine.
So we have the common carotid artery running along with the vagosympathetic trunk and the internal jugular vein, which is not visible here. And that runs parallel to the trachea. Cranial attachment of the trachea is the larynx, which is lateral to the trachea, caudal to the larynx. You have thyroid glands, right one, left one. Then we have the digastric muscle here, inserting on the mandible. The masseter muscle here, also inserting on the mandible. The parotid gland is the largest salivary gland here, near the ear. Parotid duct runs across the masseter to the corner of the mouth. Ventral facial nerve, ventral to that. Dorsal facial nerve, dorsal to the parotid duct. Mandibular gland is the medium-sized salivary gland. Its duct also runs towards the oral cavity. Here. And then just cranial to the mandibular gland is the little sublingual salivary gland. Then, digastric. Following the common carotid cranially, the level of the larynx, it bifurcates into internal carotid artery, which we don't see, and external carotid artery, which we can continue to follow through the head and neck. First branch off external carotid is the lingual artery, runs with the hypoglossal nerve. Here. Second branch off external carotid artery is external maxillary artery, supplies the mandibular salivary gland. External carotid continues and disappears, but before it does, its last branch is caudal auricular artery, which goes to supply the auricle of the ear and other structures. And then finally, you have the spinal accessory nerve, which is going to supply your sternomastoid, cleidomastoid muscles, which are here. Sternomastoid, cleidomastoid.